Also making a number of decisions that may have consequences when it comes to health care. Our Keely Arthur has a closer look at the changes and how they could impact you.
Lawmakers making decisions that go beyond curbing the power of the incoming Attorney General and Governor. The overnight measures that did and didn't pass regarding health care could impact millions of Wisconsinites. The state legislature approved new work requirements for some of the 1.2 million Medicaid recipients in the state, requiring childless adults up to age 49 to complete at least 80 hours of work to maintain coverage. Currently, the State Department of Health Services works directly with the federal government to make changes to Medicaid waivers. Advocates for those with disabilities fear what happened overnight in the Capitol could set a new precedent, making it so the State Department of Health Services first must go through the state legislature before changes to Medicaid are ultimately made at the federal level.
We're just concerned that people with disabilities and their families could get caught in the crosshairs of some sort of political football if there was disagreement between the legislature and the State Department about changes that needed to be made.
Changes like updates to Medicaid waivers, which allow people with disabilities to get additional services in the state.
Things like personal care, where people can come in and help with bathing and dressing. And there are technologies. You can, if you have a child with autism who's a flight risk, you can get your yard enclosed with fence.
On the other hand, the state Senate rejected a bill that would have created a guarantee that people with pre-existing conditions can have access to health insurance. Democrats say the measure provided inadequate coverage and would cause premiums to skyrocket.
Now, of course, for any of that to become a reality, Governor Walker would need to sign that bill into law regarding Medicaid. And in order for those pre-existing coverage things to fail, the Affordable Care Act would need to be repealed. So still things very up in the air right now.
Keely Arthur in our news center tonight. Keely, thank you.